So separation anxiety is most often experienced in younger kids. It is the difficulty being separated in any way from a parent or a caregiver. It's intense anxiety or fear around something happening to the parent or caregiver. With younger children, it can be experienced as irritability. It can be experienced as difficulty with appetite, difficulty with sleep. A lot of these kids will actually follow their parents from kind of room to room and be very upset or anxious or dysregulated if mom or dad do leave the room, if they are dropped off at daycare, if they're dropped off at school. While it's most often experienced with younger children, there is also a subset of kids who will experience separation anxiety into adolescence, and that might look a little bit different. That might look like, calling or texting mom or dad 20 or 30 times a day from school to make sure that they're okay. It may look like monitoring mom and dad to make sure that they got to a place okay, that, if they said they'd be home at 3 and it's 3:05, they become very concerned and they start calling. So any kind of intense difficulty or anxiety around the separation from a caregiver. So the treatment for separation anxiety is a combination of cognitive behavioral therapy, or CBT, and exposure response prevention, or ERP. So generally we're looking to just have the child learn to better tolerate the distress around their caregiver leaving. And so what that looks like is it starts off really small, maybe having a plan with the parent, especially if the child is younger, where the parent will go into a separate room for a certain amount of time each day, and the child will not be allowed to follow them, and will have to kind of sit with and tolerate those really big feelings of discomfort without actually following the parent into the room. For an adolescent, it might look a little bit more like, mom or dad going out to dinner and a movie without, calling and checking in with the adolescent and not telling them what time they're going to be home, so that it allows them to have that experience of sitting with the discomfort and sitting with the anxiety and knowing that they can tolerate these feelings.